Hello. If you're interested in having a dental bone graft, I want to share with you information that the dental surgeon and your dentist doesn't tell you. And I know because I've just had a dental bone graft and I want to share with you my experience. I'll just give you a bit of background. About 25 years ago, I had an accident and I lost my two front teeth. So the dentist, I didn't want to wear dentures, so they put a bridge across there. And I've had it, as I say, for 25 years. But recently I had another minor accident. I knocked the bridge, went along to the dentist and he said, well, the roots are damaged, you're going to have to take it out and wear dentures. I said, no, I don't want to wear dentures. He said, no problem, we can do you dental implants. What that will involve is taking the roots out, cutting across the jawline, through the gums, and inserting a bone graft. So they're going to graft a piece of bone, and that's just what they did. They removed the root from there, and they removed the root from there. They cut right across the top, up there, and inserted a piece of bone material. Oh yeah. Then they inserted into the jawline here a metal threaded dental implant, and then over here they inserted a dental implant. Put it in. And then they've sewed up, they pull the gums back down and sewed up over the bone graft. And then sent me home. He said, now the dental surgeon said it's going to be about 3 months, and if everything's fine, they're going to make the impressions and then they're going to screw a dental bridge back into place, and that's the end of it. But this is what I want to tell you now, is what they never told me. Here, look at this picture now of me the day after my bone graft. Now you can see I'm really swollen, but that was nothing compared to the next day. The day after that, my whole face was like a balloon. Now what had happened was this. The gums here were so swollen and inflamed. They were so sore to touch. Now, the dentist actually sent me home with a week's supply of amoxicillin and a week's supply of metronidazole. He said, you're going to need as much of these antibiotics as you can to make sure you don't get an infection in that jaw. So I assumed after 2 days that I had an infection. I rang up the dentist. He said, no, it's normal. It's normal to feel like that. There'll be weeping blood and a slight taste, a foul taste like an infection or pus coming out. He said, don't worry about it. And this went on for a week. I was in agony for a week. So I went to see my local dentist. Ibuprofen, they didn't work. I was literally, I couldn't eat properly, I couldn't sleep. I was lying in bed for a week. I went back to see the dentist again. He gave me tramadol. They didn't work. Now you've got to remember this as well. If you've got a bone graft, your gums are swollen and tender like raw liver. There's no way you can put your denture back on top. Once it becomes sore, it's just too painful, or it was in my case. And the antibiotics hadn't done anything. So my dentist made me this. It was like a gum shield with some teeth at the front. Just like that. From a distance it looks like teeth, but there's no pressure on the gums, which is good. But it was an improvement, but I still can't eat with this thing in. And my gums were still tender and they were very slow to heal. So, I'd listened to my dentist, I'd had a 3 gram sachet of antibiotics before the bone graft. I'd had a course of amoxicillin and a course of metronidazole after the bone graft, and I was still in agony. Now, this is where I resorted to my own self. For 25 years I've been helping people with natural remedies. So about 22 years ago, I came up with this blend of natural plant extracts called Gum Doctor, and it's made for people with bleeding gums, receding gums, spongy gums, gum infection. Basically, these plant extracts, you just gently touch them onto the gums where it's infected, and it promotes healing and it stops infection. And I thought, well, I've got nothing to lose. This is what I did. It's that simple to use. You just get a couple of drops of it like that brown liquid there. And I just touched it onto the bone graft. And I'm not kidding. Within 5 minutes, I could feel the inflammation going down. Now I thought, well, I know this is my remedy. And I thought, I don't want to exaggerate myself. Am I kidding myself? Am I deluded? And I thought, no. An hour later, I put some more on. I thought, Christ, I should have put this on a week ago. I put it on again at night, and the following morning when I got up was the first time I had breakfast since before the operation. Within 2 days of using this product, Gum Doctor, my teeth, the infection stopped straight away, the foul pus coming out stopped, the bleeding stopped, the inflammation went down. I don't know if you can see that. I've got a dental implant in the jawline there. I can see the abutments on top, one there and one up there. And my gums, look how hard that is. I couldn't even touch them gums 2 weeks ago. And now I can eat crisps, chips, anything I want. The gums are solid. I can put the denture back in. I'm just waiting now for the bone graft to be fully assimilated into the jaw, for the 2 dental implants to be fully assimilated into the jaw. And in about 2 months, I'm going to have my dental implant finished off, and I'm sure it's going to be fine. But my advice to you, if you're having dental implants, more importantly, if you're having a bone graft, which is a lot bigger, not everybody has a bone graft. Not everybody needs one. But if you do, which involves a lot of cutting of the gums and stitching up of the gums, the antibiotics will stop the outside world infecting you, but they don't promote healing. If anything, antibiotics reduce the rate of healing. Now I've known that for, well, everybody knows that. So this remedy, natural plant extracts, promote the healing of your gums. Now discuss this with your dental surgeon. So organic plant extracts, just a couple of drops a few times a day. Now the dentist who made me that, the same dentist that recommended all this stuff to me, is now giving this stuff. When he does dental implants, he's giving that to his clients. He said just put a couple of drops on, because he's seen it work. He saw the difference within just a few days. So good luck with your dental implants and good luck with your bone graft. I'm sure your surgeon will do a fantastic job. Discuss the Gum Doctor remedy with him. If I was you, I would buy it beforehand, before you have the operation. Just buy it. It's ready. It's meant for gums. Just dabbing it on where you've had all the stitches. I mean, I've had 20 odd stitches under that lip line there, and I dabbed it all on. I dabbed it on where the implants were, and I wish I'd have done it from day one, because it would have saved me a lot of suffering. And that's it. That's my story about bone grafts and dental bone grafts, and I'm really proud of this stuff and what it'll do, and I'm looking forward to helping you. Alright, bye for now.